So today we're going to talk about, big question that keeps coming up is, I'm going back to work and how do I continue to breastfeed? What's the best way to store my milk? How do I express my milk? How do I feed the baby? My baby's not taking a bottle. What am I going to do? And all those questions. So we're actually thinking about doing a class here. So I'm curious to see what everyone's interest is if we did a weekend class for a couple of hours, going over returning to work and how to feed a baby and a lot of the things that we're going to touch on for like 30 seconds today. We can actually do like a 2-hour class on this. As many of you know, I used to be the lactation consultant for the city of Los Angeles for about 11 years. And I ran a very, very successful corporate lactation program. So besides being a midwife, one of my actual specialties is in corporate lactation. So what you all need to know, those of you that are going back to work in the corporate world, is there's something called the Lactation Accommodation Law, which I'm sure you're all aware of. That what it means is any corporation, they are required to have a lactation room for you, and other than a restroom. And you deserve the right to express your milk. Usually it's your breaks and your lunch. Many corporations, when I was doing this for the city of Los Angeles, I would go to these other private organizations and sort of review their situation, review their floor plans, and help them come up with a location within their workspace where their mothers could express their milk. Because really, truly, you just need basically like a 2x2 little room. So when I was with the city of Los Angeles, what we did is we actually converted an electrical room. And it was great. I had 5 lactation rooms in this one building, and we served about 9,000 employees. And so we were really able to make it work. So there are ways to get a lactation room in your company that doesn't take up a lot of space. You don't need anything really special. So if you have specific questions like that, do call me and I can kind of help you figure that out. But for today's purposes, let's talk about, first of all, let's talk about how to feed a baby when you return to work. Bottles are not the only way to feed your baby. So of course they're the most convenient, and most of our child care people, our family members, anybody that's going to be feeding the baby while you're gone, they're most comfortable with feeding the baby a bottle. So the first thing you want to do is you want to get the slowest flow bottle available, because most babies will suck down your breast milk in no time. And the care provider will kind of get panicky and think, oh my gosh, the baby's still hungry, you're not making enough milk, and you're not able to keep up with the demand of the baby. Not actually because you're not making the milk, but more likely that the baby is drinking more milk than it needs. What many people don't know is that as the baby grows, you would think intuitively that the bigger the baby, the more milk it needs, right? Well, they actually don't really take in more than 4 ounces of milk at a time, regardless of their age, because the composition of the milk changes. So a 9-month-old baby isn't getting 8 ounces of milk at one time. They're still really getting about 4 ounces. It's just the composition that's much richer. So, but a lot of care providers think that it grows exponentially with the size of the baby. So the slowest flow nipple is best. We really like breast flow. I really like that bottle. It's like a nipple inside of a nipple. So the baby really has to work to get the milk out, which is really useful. Also, cup feeding and spoon feeding are very, very reasonable ways to feed a baby. If you are giving a baby a bottle, you want to watch PACED, P-A-C-E-D, PACED bottle feeding. You can watch it on YouTube. And it really talks about how you kind of pace the feeding, obviously. And you want to make that feeding really last as long as a breastfeeding session would last. And you tilt the baby, and then you sit the baby up. You don't just tilt that bottle at a 45-degree angle and let the baby go chug, 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 right? So you slow down the feeding. Halfway through, you sit the baby up, burp the baby, switch sides, right? Really mimicking a breastfeeding experience. So you can watch those videos on YouTube if you just Google it or YouTube it or whatever you do on there. I don't remember what that is. So, okay, there's that. So pumping. Depends on the age of your baby. It depends on what kind of pump you have. What we know is a lot of women say, do I have to pump, 4 times in this 8-hour period? Can't I just pump twice? I get the same amount of milk. Yes, you have to pump frequently. You're not looking at the volume. You're looking at the amount at the frequency, right? Kind of like cluster feeding. So you're better off pumping every hour for 5 minutes than twice in this long span of time for 20 minutes. But in reality, when you return to work, you're going to pump probably, you get to work, say at 9 a.m., you probably have an 11 break or something, you have a break, then you have your lunch hour, and then you have another break. That's sort of a standard in the corporate world. So those are the 3 times that you're pumping. You're going to feed the baby before you leave the house in the morning, then you're going to pump about 2 to 3 hours after you've last fed the baby, and you're going to do that every 3 hours while you're at work. And then you're going to let your care provider know when you're going to be leaving work, because you don't want this baby fed a bottle within the hour that you're going to be returning home, right? So you want to make sure that you're really communicating with the care providers so that they're not tanking the baby up on a bottle, and then you arrive and your breasts are totally engorged and you're ready to feed your baby and the baby's not interested. That's a bummer. So you want to coordinate that with your care provider. And you always want to use, ideally, a double electric pump when you return to work, because pumping both breasts at the same time is very efficient. And you also want to utilize hand expression when you're doing that. We know that, I think the statistics show that you can increase your supply, I think it's by like 30%, by using hand expression after you've used the electric pump. And very, very effective. Some women actually get a better return, they're able to express more milk with their hands using hand expression or a manual pump, because it's a hormonal response, right? We don't necessarily love our pump. Some women really don't like their pump. So when they put that pump on, their adrenaline rises, inhibits oxytocin, decreases the amount of milk they're able to express. Not the amount of milk you're making, right? You can make a full supply, but you might not be able to get it out. So that's where hand expression comes in, or a manual pump might be useful for you. You're going to try out a couple different things. Oh, there's this new pump out called a Hakka, Hakka. And super cool. It's this little pump that kind of suctions on. So before you return to work, you actually want to start pumping your milk about a month before you return to work. That's usually my standard spiel. Once a day, about 4 weeks before you return to work, because what you want to do is you want to store up milk in the freezer before you return. A good rule of thumb is you want to have about 1 ounce per hour that you're gone, and then you'd want to have as much of that in the freezer as possible. We call it like money in the bank. You don't want to live paycheck to paycheck. You want to have a little bit of savings in the bank so you don't have to worry about how you're going to pay the rent. So if you have 50 ounces of milk in the freezer, you feel really satisfied. So then when you return to work and you start expressing, you're not stressed out about, oh my gosh, I have to get enough milk today for the baby, and the baby's eating more than I'm making. And then that cycle actually decreases the amount you're able to express. So it always makes everybody feel better if they have a little bit of money in the bank. So start expressing once a day, usually about the same time every day. And for most women, the surplus, you have a surplus of milk usually in the morning. That's how most women's hormonal balance works, where usually between like 4 a.m. and noon is when you have the most milk. So that's usually when we say feed the baby, then pump. Goes back to this Hakka pump, which is really super cool. So you can nurse the baby on one side, and you take this Hakka, which is like this suction cup pump, really awesome, and you just kind of put it on there. So while the baby's nursing on one side, it's actually, without doing any work, it's kind of catching what you're losing, and it also puts some pressure there so it helps express it. So you don't have to spend so much time after you feed the baby then setting up your double electric pump and expressing. You might also want to do that depending on your supply and how much you get with that Hakka. But the Hakka is really cool, and you could start using that right away when, a couple weeks after the baby's born. It's really, really effective. So you want to start storing that milk in your freezer. And obviously you're going to chart, write on it the day that you pumped it, a morning, whatever time, morning, afternoon, late afternoon, whenever. And then you're going to stack them in your freezer. And one little trick is you pump them into bags, and then you lay them flat in your freezer. So then they freeze like little skinny books. And then you can get a little container, and then you can stack them like little books on a bookshelf. And you label them, and you stack them with the oldest milk in the front and the newest milk in the back. And so then when you return to work, you just keep, packing it in the back and pulling from the front. In the morning when you get ready to go to work, you grab your milk for the day, you bring it to your care provider, or you leave it out for whomever's coming to your home, and that's the milk that they have, and then the fresher milk is in the back. And you can store that milk in your freezer for about 4 to 6 months, depending on what kind of freezer you have. You always want to store it in the back, not necessarily on the door of it, because that's where it stays frozen better. And you want to defrost it as needed, right? Because once you defrost it, you're going to want to use that milk within 24 hours. Certainly if you defrost it and it's in a bottle and you give it to the baby, you need to finish that bottle within 24 hours, okay? Because otherwise the bacteria that's growing from the baby's mouth is in the bottle, and we don't want any bacteria growing in there. So just defrost what you need. And it just takes a few minutes to defrost the milk. Do not put it in a microwave, ever. Never put milk in a microwave. It kills the enzymes. It defrosts it and heats it unevenly. So, all those things about microwaves, just don't put breast milk in there. All you have to do is take some hot water from the tap or boil some water in a tea kettle, put it in a cup, put that bag in the cup, and it will defrost within minutes. Your milk will be defrosted. So the baby won't starve while you're defrosting your milk. Super easy to do that, but just defrost what you need at the time. The rest you're going to keep in the freezer. And then when you return to work, one of our moms said she's returning to work and she wasn't sure how she was going to store her milk because she's not exactly sure where she returns, where she's going to be able to pump. And she said, I think I might have to pump and dump. And I was like, yikes, don't do that. Bring a little snack cooler bag. That's all you need to do. Just bring your little snack bag with a couple of ice packs in it. Your milk will be fine there for 8 to 10 hours in that with the frozen ice packs, right? It just has to stay cold. Actually, it just has to stay at room temp. So just bring a little cooler bag. You don't need a special refrigerator at work. Just keep your little bag, put your milk in there, and bring it on home and stick it in the freezer, and it'll be just fine. So those are some big, broad scopes about how to pump when you're returning to work. I would love to offer a class if you guys are interested, and we could do it here at the birth center. So most importantly, you want to start pumping about 4 weeks before you return. Just in the morning when you have the most milk, once a day, no stress, cover your pump with a blanket. Don't pay attention to your volume. As soon as we start stressing about volume is when our adrenaline rises, decreases our oxytocin, and we have less volume. One really nice thing with our smartphones now is that you can, when you're pumping at work, have some video of your baby or FaceTime with your care provider so that you're just engaging with your baby while you're pumping. You're not sitting there pumping, trying to work, trying to see what your volume is, because it doesn't really, our brains don't work that way. Have a picture of your baby, have a video of your baby, maybe even bring a piece of clothing of your baby, something that's going to just hormonally connect you to your baby, because then your milk comes out better. It's pretty simple. There are, of course, women that have unique situations. There are women that work in the field. We have firefighters, police officers. Then you guys have a unique challenge in how do you pump when you're out in the field. And we have a lot of nurses as well. And I get, yes, there is a lactation accommodation law, but the reality is you're a nurse and you have a 12-hour shift. You're going to be taking care of your patients, and you're probably going to miss a lot of your pumping sessions. So you guys have a little bit of a unique situation. So you're going to have to figure out how that's going to work for you. And yes, your employers are required to give you the proper time and to give you the space, but there are work restrictions that we know that are inevitable. Midwives, if I'm pumping, I have done this actually. Had a mom pushing while I was still nursing my baby, and I had my pump, I was at a hospital and I was doing labor support for somebody, and I hadn't breastfed the baby in quite a while, so I just basically put the pump on while the mom was pushing and the room was full of people, and I was like really adept at it, so I like put my pump on and I was still able to like support her and do this whole thing while I expressed my milk, because I don't really have any issues about expressing, when I was nursing, expressing my milk. I could express my milk quite publicly and it didn't bother me. That's not everyone's cup of tea, so I don't recommend that you just like, just start pumping milk wherever, because a lot of people around you might be uncomfortable and you might be uncomfortable. But so assess your situation, obviously. You can feed your baby other than a bottle. Go on YouTube, look up paced bottle feeding. Consider using a cup or a spoon. Those are very effective ways to feed your baby. Start pumping about 4 weeks before you return to work. Have about an ounce per hour that you're gone is a nice number to have in the freezer. Your milk can last in the fridge for up to 5 days. It can stay in the freezer 4 to 6 months. You can put it in a deep freeze even longer. Do not pump and dump if you don't have access to a refrigerator. You can keep it at room temp for a little while. Bring a cooler bag with you. If you need help trying to assess some kind of work environment, if you need some help with somebody going into your corporation and saying, being creative and helping them find a space, give us a call here at the office. We can certainly work something out. I do that where I can go into places and just kind of troubleshoot for you. Happy to make any phone calls that you need. We're really committed to women maintaining their supply when they return to work. It's really important. And having a really good double electric breast pump is very helpful, and hand expression.